All right, so here I want you to look at this image of a pregnant body and a non-pregnant body. You can see that in the pregnant body, all of the organs, specifically the intestines, are smushed all the way up there. And you can see that the bowels and rectum are smushed all the way down here. So if you've been feeling a lot of like pressure up here or a lot of pressure closer to your pelvis, you know why. You can also see that that pregnancy causes the spine to have like an extended and exaggerated posture. So this is unfortunately why we feel the way we feel when we're pregnant, and having this illustration is like helpful to think about. While we're looking at anatomy, there's a few things I want you to pay close attention to. So first, look at how the baby is placed. The baby is inside the uterus. And at the very bottom of the uterus, you can see the cervix. The cervix, it's about 2 inches thick. And this is preventing the baby from just popping out of the pelvis. It's protecting the baby, protecting the amniotic fluid and everything else. You can also see that the baby's head is directly sitting on the bladder and on the pubic bone, which is why you have to pee all the time. And also notice and see the curves of the spine here, that it's not just a straight shot down for baby to come out. It actually has to take kind of like an S shape and has to navigate its way through the pelvis. And so, which is why movement, both for baby and for you, are extremely important during the process, during labor and birth. So when we are talking about dilation, we're talking about cervical dilation and not vaginal dilation. So when we're talking about centimeters and things like that and labor progress, that is all happening at the cervix, which is 2 inches thick and located inside the vagina. And we're not talking about the vaginal opening. So just a quick anatomy overview there. Okay, moving on to how we measure labor progress. So first things first, we're going to talk about dilation. So dilation is the amount that the cervix opens. And for any measurement of labor, this is done not with a scale, not with a ruler, but with our fingers. And your care provider, your midwife or OB, will do cervical checks, and that involves inserting 2 fingers and feeling for how much the cervix is dilated. So they might be feeling that's like 1 centimeter, that's 2, 3, 4, 5, 6, 7, so that's what they're feeling for. It's not an exact science, and measurements between one person and another can vary. So dilation can happen starts at like 0 centimeters and goes all the way to 10 centimeters, but that is not our only measurement of labor progress. We're also talking about cervical effacement, and effacement is the thinning of the cervix. So the cervix ends up being like a little thick. So if you can kind of imagine a balloon with a neck, the neck starts to get thinner and thinner and thinner, and that's called effacement. And effacement is measured in percentages. So 0% effaced to 100% effaced. So 100% effaced means that the cervix is totally gone and out of the way. And finally, we're also measuring station. And station is where the baby's head is in relationship to your pelvis. So right at the mid pelvis is where it's called 0 station. And then above that is -1, -2, -3, and below that is +1, +2, +3. You can see here that +3 is like basically crowning. +2, +3 is crowning. So all these 3 things work together to help labor progress. Just because you are 1 centimeter at one point doesn't mean that you necessarily are 2 centimeters at 2 hours, 3 centimeters at 3 hours, 4 centimeters, and like it doesn't necessarily work that way. You might dilate faster than you might efface. You might efface faster than you might dilate. Your station might move faster than some of the others, but it's making sure that you have a holistic picture of all three things. So for example, if you get to the hospital and somebody says, oh, you're 3 centimeters, but you feel like you've like made a lot of like progress and you kind of feel disappointed, don't necessarily feel disappointed, because ask them about effacement and station, because you could be 3 centimeters dilated, but like 80% effaced and at like -1 station, which means that you're much further along than somebody who is, say, at 3 centimeters, but at, you know, say plus at -2 station and like only 10 or 20% effaced. So all of these three things work together to make labor progress.